Neurocognitive impairment and abnormal neurological function on brain imaging has been shown frequently. It's a consistent finding among forensic samples, pointing to a lot of executive dysfunction. But I would say that probably does not generalize to community samples, especially the non-offending maps. And it may be more related to impulse control and disinhibition than sexual arousal patterns per se. Impulsivity is a related construct, and it's certainly true for some samples of child sex offenders, but it's not true for most. They are less impulsive and aggressive than other offenders, and many attempted sexual offenses against children are planned, again, due to this reduction in improvement. In one of the studies we did, we looked at child sex offenders compared to different clinical samples of active opioid-addicted subjects, and we found that the penicillin group was less impulsive, both neurocognitively and in terms of personality. Depression. Again, aggressive and violent sex offenders get the most publicity, but most people with pedophilia and non-sex offenders are not aggressive or violent. They're much less so than sexual offenders against adults. And in our qualitative studies, we saw that many community-based maps were horrified at the thought of it. So now I'm going to switch and I'm going to turn to the literature on community maps. And as I noted, there's a distinction between maps and community and forensic samples of child sex offenders. So as I noted before, many of the features that were found in forensic samples were more related to criminality than to map status per se. This might have to do with impulse control, with judgment, with a disadvantaged background, in terms of also being more likely to end up in criminal. So there is a growing body of literature on community-based maps that are used for much differentiation. And it includes qualitative research, which gives insight into the map's subjective experience, which I think is very rich, and we'll show you some of our work in this regard. Before we go further, I want to give you a real sense of the context and range of folks who get categorized as pedophilic. So this was one gentleman who participated in our study, recruited from Texas in this clinic. So this was a 41-year-old male. He was recently released from prison after a 15-year sentence for sexually abusing his 12-year-old daughter, plus unrelated attempted murder charge. He had 2 prior sentences, 1 year for unlawful entry, federal larceny, and 6 years for manslaughter. He had a history of polysubstance abuse, and he was HIV positive, and he had continued problems with aggressive outbursts. But he had no prior pedophilic behavior urges before the abuse. Now here's some context. This is a non-offender map. And I got this from an email. I got a bunch of emails around 2012. There was a group of self-identified maps, and they called themselves E40 maps, so I'll be more about this later. And they wanted to take impact. They wanted to have influence in how pedophilic disorders are defined and identified. And they were contacting anyone who might have any influence on it. Well, I had none. But when I stopped with it, I got very intrigued and I wanted to do research on this stuff. And I want to read this email and think of it in contrast to the last case example I just showed. So when I was 13, I started to realize that I was physically and emotionally attracted to younger girls, mostly ones that had not reached puberty. I had never felt too unsettled by them. I had never heard about anything sexual to any of the girls I felt were beautiful, nor have I ever been tempted to do so. Despite that, I did feel something alone. Even though I knew I wasn't purposely favored in the TV, I felt that perhaps I was the only one of my kind without these cool tendencies. I have since learned that there are many more people such as myself who are born into ways that perfectly function as parents. You, at the time, also provided essentially dating coaching. Yeah, I think the first time I was on it, sorry, I might have been talking about the flirting class that I was teaching, and I taught that class at the experimental college for 6 or 7 years until the experimental college dissolved. How to flirt well. Yes. Yeah. And you also go on the podcast to talk about open relationships. Yes. Pedophilia is defined as a psychiatric disorder in which an adult is primarily or exclusively sexually attracted to children 13 or younger. How prevalent is this?
often does it lead to a crime? And can someone with this primary attraction get help and fix? Welcome to Insights. I'm Dick Goldberg, and with us is Dr. Fred Berlin. Dr. Berlin is a psychiatrist and the founder and the director of the Johns Hopkins Sexual Disorder Clinic. That clinic specializes in the evaluation and treatment of patients with sexual disorders, including pedophilia. He's also authored several journal articles on today's subject. Dr. Berlin, thanks for joining us.
Thanks for having me. I appreciate that.
So, Dr. Berlin, is my opening definition of how common is this? How many people?
Well, we really don't know, and one of the reasons we don't know is that people who experience these attractions are understandably very fearful and frightened about others finding out. And so it would be important to gather that data, but at the present time, for obvious reasons, it's very difficult to gather it.
Well, if you had a guess, it'd be under 1%.
Nor have I ever been tempted to do so. Despite that, I did feel kind of alone. Even though I knew I wasn't what was portrayed in the media or TV, I felt that perhaps I was the only.
Hey, welcome to Pro Quickie. I'm Amy. I'm your tutor and entertainer, terrible, because we're going to be talking about something really uncomfortable, which is red flags and warning signs in adults. So, how can you figure out if someone is a potential predator? I just want to be really clear that this is not a real diagnostic, but it will help you